you a demo dissection of a fetal pig, and right here on the tray is a fetal pig. You can tell that it hasn't been born. It has the umbilical cord. Now, these fetal pigs were not killed just for the dissection that we're going to do today. These pigs were, when the sow, their mother, was slaughtered at the meat market, and the fetal pigs would have been discarded anyhow. So various supply houses purchased them, and you notice there's a gash in the neck. This is where the blood was drained out of them, and blue latex dye was injected into the veins, and red latex dye into the arteries. So when we do dissect the pig, we're going to see red and blue blood vessels, and ordinarily, of course, they would all be red with blood running through them. This pig has been embalmed with various alcohols, and you do have an option of wearing gloves. Your instructor will provide those, but for demonstration purposes, I'm not going to wear any because it does hamper the dissection. Now, in figure 6-6 in the lab book, it shows the various directions of the fetal pig and the planes. So I'm going to show these or demonstrate them on this pig. So if we can go back to our little pig here, pig stained up on all fours. Of course, the head end is the anterior or cranial part. The back end is the posterior or caudal part. The top, where the spinal column is the dorsal side. The bottom, where the belly of the animal is the ventral side. Now, if we took a buzzsaw and cut right through in this direction, the longitudinal, or the length of the animal, that's called a sagittal plane. We have a demo of a pig that was sectioned like this, and I'm going to show it, bring it right in here. This pig has been sectioned sagittally, and you can see the various internal organs. If we take a buzzsaw and cut through in this direction, the width of the pig, that's called a transverse plane. And if we take a buzzsaw and cut through the pig in this direction, that's a frontal plane. Okay. The next thing we're going to do is secure the animal onto the dissecting tray. Your instructor will show you where the ropes are, and we need 2 lengths of rope, and you're going to tie this around one limb and then pass this underneath the tray, and you want the animal on its dorsal side, the back side, and we're going to tie it securely, and then we're going to do the same with the hind limbs. Pass it underneath. And we'll make that good and tight. It doesn't have to be really tight, because we can, if like this appendage isn't out far enough, we can loop the thread or the rope like that. This has a male pig, and in figure 6.7 in your lab book, they show you the difference. And what I'm going to do is just bring in the female pig and take a look at the two together. With both pigs, you can't use the row of nipples or teats because both female here on my left and the male here on the right have 2 rows of nipples. The male has a urogenital opening right below the umbilical cord. So this little puffed up area and pore right there, that's the opening for the penis. So this is the male. If we look at the female, under the umbilical cord there is no puffed up area and no pore. Okay. The female has, in the back, right underneath the tail, a little papilla called a genital papilla. And you say, well, gee, this looks more like a male thingy, but it isn't. That indicates this is a female. If we go over to the male, you see the male doesn't have that genital papilla. He does have some swelling here, which is the scrotal sacs, but the testes haven't descended yet, so they don't look very prominent. When we dissect the male, we'll see how far the testes have gotten in their descent. They start out up here in the pelvic area and then descend down into the scrotum. Okay, so that's how to tell the difference between a male and female. I'm going to move the female out of the way and we'll dissect the male. Now the first thing with the respiratory system is we want to open up the jaw and pull the jaw down so it looks similar to figure 6.1 in your lab manual. So the jaw here has been cut at the angle and the lower jaw has been pulled down, and you can see the hard palate, the soft palate, and the epiglottis and the tongue. Those are the 4 structures we want to take a look at. Now we're going to take our scalpel. Now be careful of these scalpels because they're very sharp. They may not seem that sharp until your finger gets in the way, and then you'll see. We're going to open up the jaw of the fetal pig and slice downward on either side. Be careful when you put your finger in here to open it up, because there are little teeth that you may find out are still sharp. Now, since the fetal pig is primarily cartilage, we can cut through the jaw without much of a problem. And I'm just going to turn this a little bit to cut the other side. Okay, now we can pull this down, and we'll make a little bit more of an incision till we can see the epiglottis. Okay, now I'll take the forceps. Here is the hard palate. If you feel that it's hard, you can see the ridges, similar to the drawing in your textbook. Right below it is the soft palate. It has no ridges and is soft. And right here, this little projection is the epiglottis, the cartilage flap that closes over the airway when a person swallows. And I have my fingers on the tongue. So these are the primary features that we're going to see in the mouth. There are other structures, but they're not very well developed in the fetal pig, so we're going to skip them. Okay, the next thing, you put the lower jaw back, and in your lab book there is a dissection guide, figure 6.8. You notice the pig is in the position on the dorsal surface, and the dotted line shows you where to cut. So we're going to take our scalpel, and there's a little mole here in the chin area with a few hairs. So yes, we're going to start at the hair of its chinny chin chin. We're going to take our scalpel, cut through the skin. Now you don't want to cut too deep and cut into the larynx or voice box or the trachea. Now there's a lot of muscle here, so that's fine. And you can separate this using your gloved hand or your forceps. When you get to the chest area, you want to cut to one side of the sternum or the other and cut through the ribs. So now you want to cut a little deeper and cut into the chest cavity. When you get to the umbilical, you want to cut around the umbilical. In fact, it's good to hold the umbilical like this, cut around on both sides and pull. Now I see this animal has a lot of debris in the abdominal cavity, and we may have to wash this out under the sink, but we'll see. Okay. We opened up the chest cavity, and now we're going to take the forceps, pull the skin and other tissue back, and kind of separate the internal organs from the wall of the abdomen. Right here is the diaphragm. The diaphragm separates the thoracic cavity above from the abdominal cavity below, and it's attached to the side wall. Try to cut this near the connection of the diaphragm and the wall. Okay. Now, then you could turn this and cut underneath the arm and here near the thigh. Hopefully your pig won't have all this mess, but one never knows. You're going to need to just break the ribs a little bit, and there are dissecting pins that you use to insert and hold that flap down into the rubber of the bottom of the tray. Now you're going to lift this side, and you're going to find that there's something attached to the underside. That is the pericardial sac, the sac around the heart that's attached to the underside of the sternum. I'm going to cut that, and later on in the course, when we talk about the heart and the pericardial sac, you'll see what the function of that is. Basically, it's to stabilize the heart. This is the heart right here, and this is the lung, the right lung. So we don't want to cut through the heart or the lung, so I'm lifting with the forceps and then cutting underneath, like that. Okay. Now we're going to turn this around and do the same thing. We're going to make a flap, cut underneath the foreleg, and pull this down, and cut at the other end, bending this back. Okay. And inserting a pin. Okay, what I think I'm going to do now is stop, and we'll put this under water and wash out all this debris so you can see the abdominal structures. All right, we've washed out a lot of the abdomen, and I think you can see the organs much better. You can see some of the blue dye has leaked out. This is that latex that I was talking about. So if there is some still left after you wash it out, you can just pick it out like that. Let's go back up to the throat area, and I want to clean this out, and then we'll go over the structures. Again, be careful not to cut the larynx or the trachea. So what I'm doing is lifting some of the throat muscles and then cutting. And we'll do that. Now right there is the larynx. So, and these are muscles surrounding the larynx, and I'm just going to pull them out. You see some lymph nodes, and this could possibly be the thyroid gland right here, but we're not interested in that right now. So we're going to clean off some of the tissue on top of the structures that we're interested in, namely the larynx and the trachea. Again, here's that blue latex. This was probably the superior vena cava that I cut, major vein. Here is the carotid artery, one of the major arteries that goes up to the head area. And now we can see the trachea. I don't know if the camera can pick up the rings of the trachea. These are the tracheal rings. This is the airway or windpipe. And this bulge up here is the larynx. Okay. So let's move down. In the chest cavity, this structure right in the center is the heart. The heart is right underneath the sternum. Here's that pericardial sac that I cut earlier, and I'm going to remove the rest of it so you can see the heart a little better. And we'll do a heart dissection later on in the course. These are the ventricles. This little thing up here is one of the auricles of the heart, and we'll say more about that in another video. On either side of the heart are the lungs. Now the fetal pig has 4 lobes on one side and 3 on the other, and I think it's 3 on the left and 4 on the right. These are the lobes. This would be 1 lobe, 2 lobes, 3 lobes, and I think there's another one deeper, which we're not going to be concerned with. Notice the shiny surface over the lung. This is a moist membrane called the visceral pleura. And there is another moist membrane on the inside wall here of the chest or thorax. That's called the parietal pleura. And these 2 pleura rub against each other when the lungs inflate. And you've probably heard of the term pleurisy or pleuritis, and that is an inflammation of either of these, the parietal pleura or the visceral pleura. Here's the diaphragm right here that separates the thorax from the abdomen. This is the primary muscle for breathing. This is the liver, very large structure. It would look more brownish, but you can see the blue latex dye from the injections. If we pull the liver back, and we're going to cut this vein, move that out of the way, because right here is the gallbladder attached to the underside of the liver. I'm going to just release that. That's the gallbladder. This is the stomach right here. It looks like there's some fluid in the stomach. This brown structure is the spleen. If we pull the stomach and spleen back, I don't know if you can see this very clearly, but right in here there's some white stuff. That is the pancreas. We have the large intestines here and the small intestines here. You can see the difference, why these are called small and those large. And if we move them to one side, here we see a kidney. I'll just remove some of the membrane. Here is the left kidney, and if we move this over, this is the right kidney. I said this was a male, and the testes, I said, weren't descended. Here is a testes descended. I'm going to pull this out, and right there, this structure right there is a testis. on its way, or was on its way, down into the scrotum. This is the urinary bladder. It looks like an upright vacuum cleaner bag. And this is an artery, a vein, one of the umbilical veins. That are going from the umbilical cord to the fetus. There's one last thing I'd want to do with this pig, and this is optional. I'm going to remove the upper airway, the larynx and trachea, and we're going to try to inflate. I remove that, and we have this tube and this bulb. Okay, we have the upper airway here, and I'm going to try to insert this tube and bulb into the trachea or larynx. Okay, watch the lungs. Yeah, they sort of inflated, not very good. Then you might have seen some bubbling coming out of the lungs because the little tiny air sacs, the alveoli, are permeable to air, and they go right through the alveoli and out. Now, in a living pig or human, there'd be blood vessels all around those little air sacs that would pick up the oxygen. I'm going to try one more thing and see if it works. We're going to take the liver and pin it back using a probe, and I'm going to take my tube and stick it down the esophagus, which is right behind the larynx, and I'm going to try to blow up the stomach. So if the camera could focus down here at the stomach, and I'm going to try to pump some air in. There it is. Now I can really blow this up like a balloon. Don't overinflate it because it will pop. There are sphincters or muscles at either end, at least at the top end and at the bottom end. Now you can see what happens when I try to press on the stomach. Watch the small intestine. The air is going to go right into the small intestine. See that? That's kind of neat, something to do on rainy days. And that pretty much concludes the demo dissection of the fetal pig.